Hello, everyone, and welcome to Heads Up, the weekly webcast and podcast of the National Headache Foundation. I'm Dr. Lindsay Weitzel, migraine strategist, founder of the Facebook group Migraine Nation, and chronic daily migraine survivor. I am here today with Dr. Vincent Martin. Hello, Dr. Martin. How are you?
Good.
Dr. Martin is the director of the Headache and Facial Pain Center at the University of Cincinnati and the president of the National Headache Foundation. Today, we are going to talk about COVID, the COVID vaccine, and having a headache disorder or a migraine disorder. As a community of people with migraine and other headache disorders, we have a lot of questions surrounding COVID and the vaccine, etc. And we are going to do our best to answer those questions with the current knowledge that's out there and the current data. And we will update you as things change. So I'm going to start out, Dr. Martin, headache is a symptom of coronavirus. Honestly, it's a symptom of many viruses. Have you seen patients with migraine who have coronavirus? And if so, how did their migraine or headache patterns change once they got the virus?
I've seen a number of patients that have had COVID. Many of them have had past headache disorders, and there have been even a few that developed them for the first time after a COVID infection. But clearly, COVID increases the frequency of headache. In fact, headache is the most common neurologic symptom reported by patients that experience COVID infections. And particularly patients with migraine tend to do even worse because they have this genetic predisposition to headache. And on top of it, they get a viral infection, and all of a sudden their headaches will often pick up, and they may remain bad for weeks and sometimes even months after the infection. Now, one question that kind of comes up is does this occur with every viral infection? And I can say that there probably is some increase in the frequency of headaches with most infections, whether they be viral infections like the flu, influenza, or whether they be bacterial infections like sinus infections. But my experience is that the headaches are even worse with COVID than these other viral and or bacterial infections.
Okay. So you seem to suggest that sometimes people will develop a new type of headache after COVID, even if they weren't a migraine patient. What types of headaches are people developing? Is it a whole new headache disorder? What types of headaches are they being diagnosed with?
Well, one of them is something called new daily persistent headache. That's basically where you get a headache one day and it remains daily and continuous thereafter for over 3 months after that.
Okay.
And sometimes patients have no past history of migraines or their headache disorders, and then other times they'll have migraine and they have this daily and continuous headache pattern kind of superimposed upon that. So that's one, new daily persistent. But there's another one called intracranial hypertension, which is where the spinal fluid pressures go up and the headaches get worse when you bend over, lean forward, or if you cough, bear down, or sneeze. They're worse when you lie down. They may wake you up in the middle of the night. They may be worse when you wake up in the morning. They may be worse with different kind of weather patterns, particularly like right before rain and so forth. And those are high pressure headaches. Those have been described with COVID infections as well. And it's thought, at least theorized, that maybe the fact that clotting disorders can arise as a result of the COVID infection, that maybe the place where the spinal fluid drains in the back of the head, that tiny little clots may form and prevent drainage of spinal fluid from that sac around the brain and spinal cord.
Okay. So you've already answered one of my questions, which I was based around those of us out there that already have a headache disorder. I was going to say, are we more likely to develop worse headaches if we were to get COVID? And sounds like the answer to that is yes.
Oh, there's no doubt about it. I mean,
Okay.
there's absolutely no doubt about it. Now, the other interesting thing is that sometimes the other symptoms that patients get can influence whether someone's going to get headaches and whether they're going to be worse. So if patients develop a loss of taste or smell, and particularly the smell, it's thought that the person's more likely to have a worsening of their headaches in that situation. And the theory there is that the virus may gain entry into the brain through the olfactory nerve, which is the nerve involved in smell, and that's in your nose. So that's one reason why if that gets damaged with the COVID virus, that could indicate that maybe people are going to be more likely to get headaches.
Okay. So there's a phenomenon called post-acute COVID syndrome or long COVID. It has been compared to chronic fatigue syndrome. People who develop this syndrome often report having brain fog, inability to concentrate, or even migraine. Do you know, or do we know yet, if those of us who have migraine or other headache syndromes are more likely to develop this if we have had COVID?
I don't think we really know that. I have had a few patients that have had COVID that have had persistent symptoms, particularly chronic fatigue. And that's something you can see with a number of different viral syndromes as well. So that doesn't surprise me. But I can't say that for sure that migraine patients are more likely to have that than patients without migraine.
Okay. So let's talk about the COVID vaccine a little. First of all, I've heard a lot of people express concerns that the vaccine itself might trigger a migraine. Is this a possibility?
In my experience, there's no doubt. In fact, I have my own personal experience. I've got a history of very infrequent migraine. In fact, I've got something called migraine with aura, where I get these little flashing lights or zigzaggy lines that occur with my headaches. And
Hmm.
probably over the last 10 years prior to when I had the vaccine, I had had maybe three visual auras in 10 years. And
Hmm.
then within the month after the vaccine, I had three visual auras and actually an uptick in the headaches, even that weren't related, weren't accompanied by auras. But they were relatively short-lived. I would say the headaches kicked up for about 7 to 10 days each time, and then they calmed down. And now I feel fine. But so in my own personal experience, that's happened. Now in my patients, what's really interesting is, well, I've probably seen about 3 or 4 people that have had auras that have increased within a short time period after getting the vaccine.
Hmm.
And I even had one person who had never had a visual aura in their entire life that had an aura within 1 or 2 weeks after the vaccine. So I think this is something that's kind of evolving. We're learning more about headaches, but clearly the vaccines, probably through its activation of the immune system, is can cause some uptick in headaches in some patients.
Okay. Well, I have migraine with aura and I got my vaccine today. So we'll see how that works out for me. So my next question is, I'm curious, and I've seen people ask this in some of the migraine groups. Do we know if we should be concerned about any interactions between some of the medicines we commonly take and the vaccine?
Well, the one med that one of the first ones I thought of when you asked this question is something called prednisone. That's a steroid,
Mm-hmm.
and that's something that we commonly give when patients have have an infection and have headaches, and that's kind of my go-to,
Right.
basically. So I often will give like a course of 7 to 10 days worth of prednisone, which is a steroid. I've used that in the past in people with meningitis, like
Right.
viral meningitis, and that seems to work it's extremely effective.
Mm-hmm.
There was a question early on whether if you gave a steroid to someone with COVID, however, whether the virus might kind of replicate, when it might want to, basically cause more viral particles in someone's body if they were on steroids. But I don't think that's really hard science. So we don't really know
Right.
whether steroids are effective. I can only tell you that my own experience. That's one of my go-to medications that I give when someone has headaches related to a COVID infection. Now, if you were going to take the steroids, for example, and give them around the vaccine, I probably would not do that,
Right.
because the steroids suppress the immune system, and that may not be what you want to do when
Mm-hmm.
you're trying to develop immunity with the vaccine. So I probably wouldn't do it in that situation. Other medications that questions are, one was this whole issue of whether Botox could be given
Right.
along with the vaccine, or if someone had had a recent infection with COVID. And I can't think of any reason, because that's more of a local therapy that for the most part stays within the scalp and tissues of the neck and shoulders. I can't
Mm-hmm.
think of any reason why that would be would be a problem. It's certainly different than the filler issue. Like there were some reports that people would develop inflammation over fillers with plastic surgery, but fillers and Botox are just two different things. Then the third group of meds that there's two others. One is anti-inflammatories. There was initially some concern that maybe anti-inflammatories might modulate the immune system in an unfavorable way and be a problem with COVID, although I think that's still not been well proven. And then the fourth, so I personally don't not use anti-inflammatories in people that either have COVID or get the vaccine. So for me, that's not much of an issue. And then the fourth group of meds is something called the ARBs, the angiotensin receptor blockers. And there's one called candesartan, which is a preventative medication for migraine. And there was some concern that medication might increase the probability of getting COVID. But then there were other reports that maybe it would be used to treat severe COVID infections. In fact, there's even a randomized trial looking at that in terms of a treatment for COVID. So I don't think we really know about that particular medication, but I take one of the ARBs myself right now, so that hasn't stopped me from using that myself. I think the key thing that you really need to take away is that yes, there can be some maybe some mild uptick in headaches in some patients with the vaccine, and yes, there could be maybe some theoretic concerns about some medications that might be used around or with migraine. But the bottom line is, with COVID, you got to define risk, of like death and serious complications and damage to your lungs and maybe your heart and a stroke and blood clots and so forth. And with the COVID vaccine, could there be some unforeseen things that we don't know about? It's possible. But the way I look at it is, I think my risk of having COVID complications is higher than my risk of unknown reactions to the vaccine. So for me, it was a slam dunk. There was no way I wasn't going to take the COVID vaccine myself, but everyone's got to make that decision for themselves.
Right. And I think for me too, just some of the headache complications I've seen that we've talked about come out of COVID, being someone with such a severe history of migraine myself, I really did want the vaccine, despite the fact that perhaps I could have a kick up or a pain flare for a short time. So again, it is a decision that everyone has to come to on their own. Is there anything else you'd like to add to the topic of headache syndromes and COVID or the COVID vaccine?
No, I'll probably finish by saying, regardless of whether you take the vaccine, I would hope that people are practicing social distancing and wearing their masks, because even if you get the COVID vaccine, that doesn't mean that you should stop wearing your mask, because there still is a small chance that you could get COVID, and there's still probably a small chance you could transmit the virus to someone else. And particularly if there's a large segment of the population that has not been either immunized or had the virus where they've developed some immunity, then from a public health standpoint, we really need people to be good all the safe measures that we have to prevent COVID infections.
Right. And that's a great way to close. And thank you for joining us today, Dr. Martin. And thank you everyone for joining us for this episode of Heads Up. Please join us again next week for the webcast and podcast of the National Headache Foundation. Thank you and goodbye.